I'm Michael Christensen. Grateful to be with you and have the chance to present our work on the development of a patient-centered communication curriculum for radiation oncology residents, a project that's a work in progress. So radiation oncologists frequently speak with patients who are terminally ill and may be near the end of their life. Up to 50% of patients who die of cancer receive palliative radiotherapy in their last year. Unfortunately, patients commonly report that the conversations that they have with their physicians are suboptimal. And while this is disappointing, it may be understandable given the complex and sensitive nature of these conversations, and the skills required go beyond those taught in medical school. Education on serious illness communication skills for radiation oncology residents is lacking, and this was highlighted in a publication of radiation oncology residency program directors. So we sought to develop a curriculum that addressed this need, and we followed the 6-step approach shown here. So once we identified this problem, we then performed a targeted needs assessment. That consisted of a cross-sectional survey and semi-structured interviews of the radiation oncology residents at our institution. The point of this survey was to get a sense of their level of preparedness and comfort with a variety of serious illness communication scenarios and topics. And these results reaffirmed the opportunity for improvement at the residency program level. Most residents felt only somewhat prepared to discuss important topics such as prognosis, reconciling the seriousness of one's illness, and discontinuing life-sustaining treatments. So we developed a course to address this need with the objective of improving measurable serious illness communication skills for radiation oncology residents. Our course consisted first of a simulated patient encounter for each of the residents that was radiation oncology specific. It was done using trained actors and done in our university simulation center and recorded for later assessment. We then held 2 virtual half-day learning sessions that comprised of a didactic, but really had the focus being on guided practice with real-time feedback. These sessions were led by attendings in palliative care and radiation oncology who are trained in teaching and demonstrating serious illness communication skills. 2 weeks after the course, we then held another simulated patient encounter for the residents. We were interested in evaluating the outcomes of this curriculum in a variety of ways. First, we had each of the residents complete surveys before and after the course. Again, these were addressed to try and get a sense of their level of preparedness and comfort with a variety of these topics. Next, we also are in the process now of completing validated assessments that look at observable communication skills shown on the right. Using the recordings from the simulated patient encounters, we're having other attendings who were otherwise uninvolved in the course review these videos from the pre and post-course encounters, and do so in a blinded fashion. We also had assessments completed by the simulated patient actors immediately following each of the encounters, with the intention of getting a sense of their perception of the residents' communication skills, the ability that they had to respond to emotions appropriately, and other things. And then each of the residents also completed a formal curriculum evaluation at the end of the course. So I'm excited to share some of our preliminary results with you. First, focusing on the surveys that the residents themselves completed. I'm highlighting here the lowest 3 areas where the residents felt least comfortable at baseline. Those were discussing with a patient a prognostic estimate for survival, discussing with a patient who has not accepted the seriousness of their illness, and talking about discontinuing life-sustaining treatments. You can appreciate the notable improvement in the level of comfort the residents had after the course. Similarly, the areas where the residents at baseline felt most comfortable were recognizing the importance of the patient's values, preferences, and goals, conveying serious news about the patient's illness, and expressing empathy. And even in these areas, the residents showed notable improvement in their comfort and preparedness. When breaking these results up based on level of training, we noted that less experienced residents felt less prepared and less comfortable at baseline, but when compared to PGY-5 residents, but all residents overall on average felt more comfortable and more prepared after the course. As for the assessment completed by the simulated patient actors, broken down by training level, we noted that the PGY2 residents scored the lowest on their baseline assessment, but they, as well as other less experienced trainees, showed significant improvement after the course. As for the PGY5s who were nearing graduation and possibly suffering from a mild case of senioritis, they scored the exact same on the pre and post test. But overall, all residents on average scored higher by the simulated patients on their serious illness communication skills. As for curriculum evaluation, 100% of the residents felt that similar training should be required of all radiation oncology residents. And we received numerous pieces of positive feedback as well as areas where we can improve. As for the future, we're very enthusiastic to repeat this in the future, which would allow us to assess the durability of these results, track individual progress, and monitor general trends over time, as well as implement curriculum improvements. We also would like in the future to incorporate actual patient experiences to try and assess clinically relevant outcomes. Also, there's an association with effective patient communication and physician satisfaction and burnout, and we'd like to incorporate that in this study in the future. And as been alluded previously in this meeting, hopefully we'd like this to serve as an adaptable model that can be used among other radiation oncology residency programs and collaborate with those who are currently doing similar work. Thanks.